Hello and welcome back. Today we are talking about the obsessive compulsive disorders and related disorders. As always, let's kick it off with a question. So a 23-year-old man reports frequent intrusive thoughts about contamination. He spends hours daily washing his hands to relieve his anxiety. Which disorder best describes his condition? Is it A, body dysmorphic disorder, B, panic disorder, C, obsessive compulsive disorder, or D, generalized anxiety disorder? Think about it and then let's move along and we'll get back to the answer at the end. So what are obsessive compulsive and related disorders? So these were previously grouped under anxiety disorders in the prior DSM manual, but in the more updated ones, it is reclassified as obsessive compulsive and related disorders. So our MCAT focus is going to be obsessive compulsive disorder, also known as OCD, and body dysmorphic disorder, also known as BDD. Let's kick it off with obsessive compulsive disorder. So in OCD, you have two things. You have both obsessions and compulsions. Obsessions are basically thoughts. So they're persistent, intrusive thoughts or impulses that lead to anxiety. And compulsions are then repetitive behaviors performed to reduce the anxiety from the obsession. So obsession is a thought, compulsion is an action or a behavior, and this ends up creating a cycle. So we start with the obsession or the intrusive thought that leads us to get stressed out and anxious, and then that leads us to perform a compulsion or a behavior, which then reduces the stress, and then this turns into a reinforcing cycle. Whenever I have an intrusive thought, I know that the behavior or acting it out will then alleviate that stress and make me feel better temporarily, so it keeps going in this cycle. Now, you might be thinking, well, hey, most of the time we say that a lot of us are perfectionists or that we're OCD. But in reality, what we're talking about is type A people that are OCPD. OCPD is obsessive compulsive personality disorder. That actually tends to serve us really well when we are very type A. We like things to be organized. But the difference is OCD is actually a disorder that ends up taking up more than 1 hour of your day with these intrusive thoughts or with these repetitive behaviors. So at the end of the day, we're actually very distressed by having to continually think about these things and continually have to do these behaviors. Sometimes people, if they have severe OCD, can spend from 1, 2, 3, 4, 5, many hours throughout the day having these intrusive thoughts and repetitive behaviors. So that's the difference between when we say OCD as a clinical diagnosis versus when we refer to ourselves, most pre-med and med students and doctors, as type A, wanting our calendars to be color-coded, wanting things in our rooms or desks to be very organized. That is not necessarily distressing to us, and it doesn't occupy all of our time throughout the day trying to cope with the stress and anxiety of the obsessions and compulsions. And here we can take a look at an example, an obsession about germs. Someone might be thinking that everything that is around them has germs on it. And then in order to reduce the stress, we perform the compulsion, which is repeated hand washing. So the thought then leads to the behavior. And here is our OCD cycle. So we have the obsessive thought that causes us anxiety. We do the compulsive behavior, and then that leads to temporary relief until the next time we have the obsessive and intrusive thought that enters into our mind and we re-enter the cycle. So some of the most common obsessions or intrusive thoughts include contamination, like germs, dirt, illness, doubt and responsibility, feeling like you might have forgotten to lock the door or leaving the stove on, and that might then burn the house down. Order and symmetry, feeling like we need things to be just in order, spending, hours on end trying to line up the edges of our sheets. And then aggressive and forbidden impulses, such as thinking of harming other people, having maybe inappropriate sexual thoughts about family members, or other religious thoughts and ideas. So those are common obsessions. The most common compulsions or repetitive behaviors include cleaning and washing, so maybe washing our hands many hours a day or multiple times during one hand washing event, bleaching surfaces many hours throughout the day, checking things, locks, appliances, making sure the gas stove is off, doing repeated checks of your homework to make sure it was correct, counting, for example, every time you take a couple of steps, you have to count 1, 2, 3, and then count again, and then repeat that action many, many times, arranging and ordering things, making sure things are in line, and repeating other actions such as, when you pass the doorway, you have to maybe pass it 5 times before you can finally leave the house. So those are some of the most common repetitive behaviors. Now, from here, we transition on to body dysmorphic disorder, BDD. The definition is that this is an unrealistic evaluation of one's own body, your own appearance, and your own attractiveness. Basically, you think something is very wrong or ugly and not right, even though to the rest of the world, it is absolutely normal in appearance. Oftentimes, it doesn't tend to be generalized. It's more so focused on one part of the body. So it might be the nose, the skin, the stomach, a specific muscle, maybe your eyes. And so there's this perception that that particular part is either ugly or deformed, even though it is actually normal to everyone else that looks at you. And remember, the issue with any kind of psychiatric disorder is that it leads to impairment in daily function. You are spending so many hours a day looking at the mirror or trying to think about this body part that it leads to dysfunction. And at the end of the day, people end up seeking many repeated plastic surgeries or extreme interventions to try and fix that perceived flaw. So an example might be that a patient is convinced that their nose is absolutely hideous, and they end up getting one surgery and then it's still hideous, and then a second surgery and it's still hideous. And so that thought never really goes away despite the interventions. A neat mnemonic to remember: BDD equals body detail distorted. So if we look at the DSM criteria, we have a preoccupation, a perceived defect or flaw in our physical appearance that is not observable to others. And then at some point during the disorder, there might be repetitive behaviors like checking the mirror multiple times, skin picking, seeking reassurance about the appearance, and just overall having extreme concerns. And there is preoccupation that then leads to significant distress and impairment in function. And there we have it, our cheat sheet. OCD is having intrusive thoughts leading to repetitive behaviors. So the obsessions create stress and the compulsions relieve stress. And in BDD, we have a focus with body appearance, a specific body part, a perceived defect that in reality is actually normal to the rest of the world. And we end up seeking many surgeries or interventions. And no matter how many interventions we get, that perceived defect remains. All right, so now it's your turn. Let's take a look at our practice questions again. A 23-year-old man reports frequent intrusive thoughts about contamination, spending hours daily washing hands to relieve the anxiety. What disorder? And this obviously is going to be obsessive compulsive disorder. Remember, body dysmorphia has to do with a perceived defect in one body part. Panic disorder is someone has a fear of recurring panic attacks, and generalized anxiety disorder is when we are anxious about literally everything in our life. So this is OCD. Next question: a woman is convinced her skin looks horribly scarred despite reassurance and normal physical exam findings. She has sought multiple cosmetic procedures. Which disorder is this? Is it social anxiety, body dysmorphia, OCD, or agoraphobia? And the answer here is body dysmorphic disorder. Remember, social anxiety is when we have a fear of going out in public because of negative evaluation or judgment from other people. Body dysmorphia is this perceived defect. So in this situation, this person thinks that their skin is horribly scarred when in reality it's not. OCD is when we have the obsessions and compulsions, and agoraphobia is kind of a fear of public spaces and not being able to escape. So oftentimes we stay at home to avoid anything bad happening in those public spaces. Great work so far. Key takeaways: OCD, obsession leading to stress, leading to compulsion, leading to alleviation of stress, which is a cycle that just repeats itself. Body dysmorphic disorder is when we have distorted body image leading to surgeries and procedures and functional impairment, and the perceived defect still remains despite intervention. And then again, watch out for the difference in OCD versus